Hi, my name is Anya Vander, and my speech is titled The Problem with Lyme. Imagine you are just an ordinary person going for a hike at Cor Andre. You enjoy the summer weather and you love to go for a hike in the woods. This time, however, you end up getting a tick bite. Weeks later, you are diagnosed with Lyme disease. When you have Lyme disease, you are suffering greatly. Your job is affected, but you're thankful that you have health insurance. That's going to cover your treatment costs, right? If you think that, you are wrong. According to the article How Lyme Disease Spreads, written by the CDC in 2024, approximately 476,000 people may be diagnosed and treated for Lyme disease each year in the United States. One of my close friends has dealt with Lyme disease for about 3 years now. I have seen how much it affects a person's life up close. There needs to be action taken to aid people with this disease. Health insurance should pay for Lyme disease treatments. Today, I will talk about the problem of Lyme disease. Next, I will talk about why insurance agencies do not typically cover the cost of treatment. And lastly, the solution to this problem. To understand why health insurance should cover Lyme disease treatments, we first need to look at some background information. What is Lyme disease? Lyme disease is a serious disease that is typically caused by a tick bite. Most people will get a rash from the bite called a bullseye rash due to the red ring around the bite. Not everybody will get this rash or remember getting bitten. Because of this, it can be difficult to receive a Lyme disease diagnosis. The Mayo Clinic website states the initial symptoms of Lyme disease are like those of the common flu: fatigue, fever, headaches, joint stiffness, and pain. Lyme disease can be treated easily if it is caught early. The problem is the longer it persists, the more difficult it is to be treated. Now that we know what Lyme disease is, why does health insurance not cover costs? Usually, health insurance companies will pay for patients to be treated with Lyme disease for the first initial treatments, including the diagnosis. For those with long-term treatment needs, there are very few health insurance options available. Insurance companies are not required to pay for chronic Lyme disease because there's debate about the accuracy of this diagnosis. According to the Seattle University School of Law article, It's All About Lyme, published in 2022, the term chronic Lyme disease is steeped in controversy because IDSA doctors believe that the diagnosis constitutes medical fraud, whereas ILADS doctors believe that this term accurately describes patients with complex infection beyond the acute phase. Insurance agencies should be required to pay for chronic Lyme disease treatments because patients paying for health insurance should be receiving the care that they pay for. These treatments are expensive. However, people who are paying for health insurance should be gaining the care that is due to them. Additionally, Lyme disease disrupts life. Because of doctor's appointments, treatments, and symptoms, many people struggle with Lyme disease, have trouble keeping their jobs. Insurance companies should help patients with treatments so that they can focus on getting better and keeping their jobs. To end, Lyme disease is an issue that affects many Americans annually. This is a problem for many people. On top of dealing with a health crisis, they need to pay massive amounts of money for treatment. To solve this problem, changes should be made to the requirements for insurance coverage because people who are paying for health insurance should be able to get what they paid for. It takes time to gain more information about this topic and to make changes. However, small steps can turn into big changes.